Top signs that your colon may be in danger. Colon cancer, also known as colorectal cancer, is a form of cancer that develops in the colon or rectum, parts of the large intestine. It is one of the most common forms of cancer worldwide and can affect men and women of all ages, although it is more common in people over 50 years old. Colon cancer usually develops slowly over several years, starting as non-cancerous growths called polyps that can become cancerous over time. With early diagnosis and proper treatment, many cases of colon cancer are treatable and have good prospects for cure. However, awareness of the signs and symptoms, as well as participation in screening programs, play a key role in the prevention and early detection of this disease. Next, we will discover what the main signs of colon cancer are. If you have any of these symptoms, see a doctor as soon as possible. Number 1. Changes in bowel habits. One of the first noticeable changes may be an alteration in bowel movement patterns. This may include persistent constipation, frequent diarrhea, or a feeling that the bowel has not been completely emptied after a bowel movement. These changes may be present for weeks or months and may be accompanied by abdominal discomfort, cramping, or bloating. When these changes are unexplained and persist, especially if you are over 50 years old, the age at which the risk of colon cancer increases, it is important to consult a doctor for a more thorough evaluation. Number 2. Rectal bleeding or blood in the stool. Blood in the stool or rectal bleeding are potential signs of a range of conditions, including colon cancer. Bleeding may appear as blood spots in the stool, bright red blood on toilet paper after a bowel movement, or even mixed with the stool. It is crucial not to ignore this symptom, as it may indicate a variety of health problems, including precancerous polyps or colon cancer. If you experience any rectal bleeding without an apparent cause, it is essential to seek medical guidance for a complete evaluation and possible colon cancer screening. If you're looking for a complete life transformation over the next 3 weeks, then you're in the right place. We present you the Smoothie Diet, the weight loss program that is revolutionizing the world due to its speed and effectiveness. Whether you need to lose the last 5 to 10 pounds or you want to get rid of 40 pounds or more, this will work for you. This diet is extremely flexible, so even though this program is 21 days, you can continue using it for as long as you want to lose as much weight as you want. In this program you will receive the complete 21-day weight loss and health improvement program, over 36 delicious fat-melting meal replacement smoothie recipes, shopping lists for each week to make it super simple to get everything you need, and smoothie making tips and prep guide to make sure there is zero trial and error. In addition to receiving 2 more bonuses to further enhance your weight loss. For more information, access the link in the description, or the link pinned in the first comment. Number 3. Changes in stool shape. Changes in stool shape can be a warning sign for colon cancer. For example, stools thinner than usual, often described as ribbons or pencils, may indicate narrowing of the colon due to the presence of a tumor. This narrowing can make it difficult for stools to pass, resulting in stools thinner than usual. If you notice a persistent change in stool shape or size, it is important to mention this to your doctor for a proper evaluation. Number 4. Urgency or frequent need to evacuate. A persistent sense of urgency to evacuate or a frequent need to go to the bathroom, especially if not associated with a high-fiber diet or other known gastrointestinal conditions, may be a warning sign of colon cancer. This can occur when a tumor is partially obstructing the colon, causing irritation and increased sensation of the need to evacuate. If you experience this sense of urgency or frequent need to evacuate without an obvious explanation, it is important to discuss it with your doctor for a more thorough evaluation. Number 5. Persistent abdominal pain. Abdominal pain related to colon cancer can range from mild to intense and is often described as cramping or dull pain in the lower abdomen. This pain may be intermittent at first but tends to become more persistent as the cancer progresses. The pain may be accompanied by other gastrointestinal symptoms, such as changes in bowel habits, abdominal bloating, nausea, or feeling full after meals. Persistent abdominal pain, especially when there is no obvious explanation, such as a known gastrointestinal condition like irritable bowel syndrome or inflammatory bowel disease, should be investigated by a doctor to rule out more serious problems, such as colon cancer. Number 6. Unexplained weakness and fatigue. Fatigue is common in many health conditions, but when it is persistent, severe, and cannot be explained by factors such as lack of sleep, stress, or excessive physical activity, it may be a warning sign of colon cancer. Fatigue related to colon cancer can be caused by chronic blood loss in the stool, leading to anemia, or by the cancer itself, which consumes energy from the body as it grows and spreads. Weakness may also be a symptom of nutritional deficiencies due to absorption problems in the intestine. It is important not to ignore persistent and unexplained fatigue and to consult a doctor to investigate its underlying causes, including the possibility of colon cancer. Number 7. Unintentional weight loss. Unexplained and unintentional weight loss can be a concerning and often overlooked symptom of colon cancer. This weight loss may occur even when food intake remains the same or increases, and is often a sign that the body is fighting an underlying illness. In colon cancer, weight loss can be caused by bleeding in the stool, by the presence of the tumor itself, which consumes nutrients from the body, or by accelerated metabolism due to cancer growth. If you are losing weight without trying or without an obvious explanation, it is essential to consult a doctor for a complete evaluation and possible colon cancer screening. Number 8. Unexplained anemia. Anemia occurs when the body does not have enough healthy red blood cells to carry oxygen to the body's tissues. In colon cancer, anemia often results from chronic blood loss in the stool, even if it is not visible to the naked eye. Slow and steady bleeding in the intestine can lead to a gradual decrease in hemoglobin levels and red blood cells, resulting in symptoms of anemia, such as fatigue, weakness, pallor, shortness of breath, and dizziness. If you experience symptoms of anemia without an obvious cause, it is important to seek medical guidance for a complete evaluation and possible investigation of colon cancer. Thanks for watching until the end. Don't forget to like, subscribe to the channel and share with your friends.